Understanding normal versus abnormal blood sugar is a key concept to good health that everyone must understand. Not just diabetics, not just those with insulin resistance, but everyone. Hey Wellness Warriors, I'm Dr. Zyrowski, and I started my holistic health practice in order to help you take control of your health naturally, because true health only comes naturally. Be sure to subscribe to the channel, hit that notification bell, and give this video a thumbs up. Then share with me your thoughts in the comment section below. Did you know that the average person consumes over 130 pounds of sugar per year, most of which is consumed unknowingly? Now you're probably thinking to yourself, well, that's not me, I don't do that, because you're thinking about taking the sugar bowl and putting scoops of sugar into your food. But the fact is that 70% of processed foods contain a lot of sugar, and even the healthy foods contain a bunch of sugar as well. Beyond processed foods, sugary drinks are a major culprit in causing your blood sugar to spiral out of control. My brother was completely addicted to soda, and after months of me trying to convince him to stop, he finally did. And about a month after quitting, he called me and he was just ecstatic, and he says, "You're not gonna believe this, but I lost 15 pounds this month and all I did was quit drinking soda." Surprised? I wasn't surprised at all, because this blood sugar instability in the body causes havoc across the entire system, and it even causes you to have the inability to lose weight. So you're probably thinking to yourself, okay, I can change my lifestyle, but how do I know if I have high blood sugar? Well, the good news is you can actually do a very simple blood sugar test right in the comfort of your home. You can go to a local pharmacy or grocery store probably, and you can pick up one of these very simple glucose meters. You can test your blood sugar right in the comfort of your home, and I'm gonna show you how. The first step to testing your blood sugar is that you wanna be fasted for 8 hours. It's easiest to do first thing in the morning because you're naturally fasted. From there, you wanna make sure that your hands are good and clean. Make sure that you wash them well. And if your hands are cold, what you can do is either rub them together or just wash them in warm water. It'll help warm them up and increase circulation. All right, so my hands are clean, ready to go. I'm gonna take the glucose monitor here and the test strip, and I'm gonna plug that in, make sure it's ready to go so that when I do prick my finger, I have it ready to be used. Then I'm gonna grab the lancet, and I wanna make sure that I poke on the side of my finger, because if you actually poke on the pad of your finger, it's gonna hurt a little bit more. There's less nerves on the side, so that's the ideal place to do it. So you put this up to your finger, and gets me every time. You're gonna squeeze a droplet of blood out, wipe it. You wanna wipe away the first droplet with a cotton swab or a paper towel, something that's clean. And then the next droplet of blood, you squeeze out like that and touch it to the test strip, and the test strip will absorb it, bring it up to the meter, and then you'll have your answer. Now that you have your blood sugar reading, it's a very good thing to chart it down. So that way you can know if you're getting positive changes or the lack thereof. And you can know that if you're implementing a dietary change or supplemental change, or you're exercising more, you can see what's moving the needle and know whether or not you're on the right trajectory of fixing your blood sugar problems. I'll also put a link in the description below to a complimentary download to the best strategies that I use in my clinic in order to help you lower your blood sugar naturally and without medication. You can find that in the description below. Now that you have a number on your monitor, you're probably wondering, what does that number mean? Because that number is very important for your overall health, your cardiovascular health, your liver health, metabolic health, everything. Now, if you fell between 80 and 100, congratulations, because that's considered to be normal blood sugar. Now, if you fell between 100 and 125 milligrams per deciliter, this is an indication of prediabetes. It's estimated that 85 million people suffer from this, or 1 in 3 adults. Now, it's also estimated that within 5 to 10 years, you'll be a full-blown type 2 diabetic. So it's important to make sure that you're taking this seriously and it's time to take action. Most doctors at this point will tell you that they want to monitor it, but they'll give you no real strategies in order to reverse insulin resistance. Typically, they'll have you wait it out until you're a full-blown type 2 diabetic, and then they'll manage it with medications. A friend of mine recently got his blood test done, and when he got the results back, he sent them to me. He said, "Can you take a look at these and tell me if you see anything?" As soon as I looked at him, I said, "Well, did you know that you're a pre-diabetic? Did your doctor tell you that?" He said, "No, my doctor didn't tell me anything. He literally told me nothing. He just said he would see me next year." This type of methodology in patient care is completely unacceptable. His doctor should have given him real strategies to fix the problem, not wait till he is a full-blown type 2 diabetic and then wants to put him on medication. It's completely unacceptable. I also want to mention, while we're on the topic of prediabetes, that many children have this issue today. It's an absolute travesty that parents allow this to happen to their children, because prediabetes and even type 2 diabetes in general used to be a problem that only existed in adults, but now it's a major problem in young children. Now let's get back to the numbers. We discussed 80 to 100 being safe zone, 100 to 125 milligrams per deciliter being prediabetes. Now 125 and up is considered to be type 2 diabetes. Now, before you lose hope, understand that this problem can be reversed. I help many people recover from this and reverse type 2 diabetes every single day, but you have to take it seriously. You have to take it very seriously, and downloading the guide in the description will be the first step to taking action. Now, how long it'll take to reverse insulin resistance will vary from one person to the next. There's a few things to take into consideration, like how long have you had it? The longer that you've had insulin resistance, the longer it'll take to reverse it. To what extent do you have it? Do you have a severe case or do you have a light case? And the other factors really depend on you, and it's how much are you willing to put on the line in order to fix this problem? Are you willing to change your diet? Are you willing to stick to your diet? Are you willing to exercise? How often are you willing to exercise? Are you willing to take nutritional supplementation? And are you willing to stick with it and take them every day? These are all factors and big questions that you're gonna have to start asking yourself if you have this problem. As I said, you have to be very positive that this can be reversed, because I work with people every day and we make this happen. But you have to be dedicated, and your level of dedication is what is going to take you over the finish line and help you reverse this problem and live a much better quality of life in your future. If you know someone who's suffering with insulin resistance, share this video with them, because you will change their life. Now, to learn the best exercise in order to reverse insulin resistance, watch this video right here. They were saying is not only did their insulin become more sensitive, not only did they decrease insulin levels, but the other thing that happened there is their blood sugar went down. And they also were able to lose weight, and they actually specifically mentioned that they had fat loss.